Hello. So today we are going to talk a little bit about the time when we finish university, the time when after graduation we start to work. Well, basically becoming a junior clinician, there comes a time where we have to make a decision where we should start working. Should we open our own practice? Should we join as many clinics as possible? Should we just join one clinic and have a team approach environment? Should we work solo? Well, basically, there are many solutions out there, and all of them are obviously viable. So which one should we decide to go for? Well, basically, after graduation, I think we tend to have the feeling that we know all the answers to the possible cases that might appear in our offices. Well, basically, we think that we have the solution for everything. But by the moment that you start to work and you start to face the reality, and unfortunately your teachers are not there anymore to support you, to guide you, sometimes you are faced with some situations where you are uncertain of the treatment or of the outcomes, and you start to get more insecure. So this can bring you some fear, can bring you some disappointment, and instead of your learning curve to continue to grow, it can get like stagnant or can even decrease. So this is not good for you, because you always want your learning curve to grow more and you want to improve along the times. So basically, where should you go to work? Well, I tell you, when I finished my university, when I finished my studies, I joined in the first months a lot of different clinics. I was working in several different clinics in Lisbon area, and actually also a clinic in the Algarve. And so I had different time slots, and I would go to the several clinics. Of course, this helped me to develop my practical skills, to control my time, to organize myself in terms of thinking, in terms of treatment plan, in terms of diagnosis. It helped me a lot. But at certain point, I realized that I was just learning from myself. I basically was the majority of the appointments, I was alone in the office, so I had no one that could guide me or could help me to improve. And so I started to feel that I was like stagnating, and I didn't enjoy that. So I had to look for something else. So basically, this was the time that I decided to join just one clinic, the MALOCLINIC in Lisbon. So it was 15 years ago, and this is when I joined the MALOCLINIC. And basically, at this time, I realized that I really liked and enjoyed to work in a team approach clinic where everybody was more specialized in his fields. And this brought me a lot of joy, because I could also basically work exactly in the areas that gave me more pleasure, which were surgery and periodontology. So basically, I started to work there, and it's incredible that you can have other people that have more experience than you, with whom you can discuss the cases, with whom you can discuss your treatment plans, and also expect that you continue to learn, that you continue to improve, so that you can bring more knowledge to the clinic, make them also improve themselves, but also bring better treatments for the patients. So actually, this is my biggest advice to you, is when you are a junior clinician, that you should look for clinics that, even if you have all the money to invest and to open your own clinic, spend that money on studies first, continue your education, give you more knowledge, more practical skills, and then you maybe later you will do this. But when you start to work, look for the mentors in the field. Check if they have any clinics where you could work with them. Check who are the people that are ahead in terms of dentistry. As you know, Palmalo has been one of my biggest mentors for the last 15 years. So with him, I learned not only to improve my surgical skills, but to ask myself a lot about all the dogmas that we are taught when we are younger. To learn how to believe in myself, to have the capacity to want to be better every day. So and many other colleagues at the clinic pushed me to become better every day. So look for which are the clinics that have this team approach, that have these environments that where you can improve your skills, and basically these are my advices to you. So grab a journal, grab your journal to write down the following questions, please. So this is now your task. This is where you have to think for yourself and just check on the solution. So the first question is actually who are the big players in your field? Who are the people that you admire that could probably mentor you? Could you work with them? This is the first question. Second question is which are the team approach clinics that you have where you could work? Would does anyone work there that you probably already know? Could you talk to this person? Could you see if your expectations meet the reality that people live in that clinic? And the third also, which is very important, considering these clinics, which one of them do the treatments be defined by excellence? So which ones do excellent treatments? The second is on these clinics, do they have a good floatability of patients? Do they have a lot of patients? Because you want to work more, you want to do a lot of cases if possible, so it's important that you develop your technical skills. And third, is this type of clinic a clinic that will value your work and will support or in your continued education? So this is very important when you decide where you should start your clinical work after finishing university. So I hope you enjoyed these tips. I hope they have been helpful for you. Think about them, write in your journal, and have a good day.